Hello, Mrs. James. How are you doing? That's good to hear. My name's Fernando. I'm going to be your nurse today. Can you confirm your name and date of birth for me, please? LeBron James, December 30th, 1984. Wonderful. And do you have any allergies? Like, are you allergic to chlorhexidine, or do you have any tape allergies I should know of? No? All right. So the reason why I'm here is because I'm inserting the Foley catheter in you today. Have you ever had that done before? You have. Okay. Well, let me explain it to you anyways. So the reason why we're putting a Foley catheter in you today is because you're retaining some urine in your bladder. So the catheter will help it be a little easier to eliminate that retention of urine in your bladder. So I'm going to start off by cleaning the labia, and I'm going to proceed by inserting the catheter through the urethra, and it's going to go up to the bladder. Once it's in the bladder, I'm going to inflate a small balloon with saline. This is going to help the catheter stay in the bladder. It shouldn't be painful. It might feel a little uncomfortable or awkward, but if you feel any pain during the procedure, please let me know, okay? And then afterwards, I'm going to take a urine sample. I'm going to send it to the lab and have them check for any infection or anything else that they're looking for. And I'm also going to attach this tubing to a stat lock, or to what's called a stat lock, to your upper thigh. This is so that the tubing doesn't get stuck or obstructed on anything, okay? And there will also be a collection bag right next to your bed. And that should be it. Do you have any questions or concerns for me? No? All right. And are you in any pain or discomfort right now? No? All right. Well, let's get started. I'm going to get my supplies and dust ready, okay? All right. I'm going to do 20 seconds of hand hygiene. All right. Oh, there goes that glove. Clean the table for about 30 seconds, let it dry for 2 minutes. And then I'm going to close the patient's curtains for privacy. I'm going to do 20 seconds of hand hygiene. All right, Mrs. James, you're going to go ahead and get started by cleaning the labia, okay? Put the patient in supine position. Put the bed down. There's a Chuck's pad in place. Is it okay if I lift your gown? Okay, thank you. I'm going to place your legs in a frog-like position, okay? Let me know if there's any pain. Any pain with that? No? Any pain with this? No? Okay, hang tight for me, okay? I'm going to get my wipes. I'm going to do 20 seconds of hand hygiene. Alright, it's going to be a little cold, okay? I apologize. For the meantime, I'm going to do 20 seconds of hand hygiene. Gloves. Alright, so my table's been drying for 2 minutes, so it should be okay. My supplies down. So I have my stat lock here. I have my 10 milliliter syringe. I have my chlorhexidine wipe. I have my Foley catheter kit here. Take out. I'm gonna make sure to only touch that outer border. Legs. I'm going to drop in my supplies now. Is it okay if I lift the gown? Yes. Okay. Thank you. I'm going to go ahead and do 20 seconds of hand hygiene. Alright, Mrs. James, we're going to go ahead and get started, okay? Alright, it's going to be a little cold, okay? I apologize. Okay, Mrs. James, I'm going to start putting in the catheter. I want you to take a deep breath in. Take a deep breath out on the count of 3. 1, 2, 3. Deep breath out. Deep breath out. Doing a great job. I see urine, so I'm going to advance 1 or 2 more inches. Alright. Go ahead and inflate the balloon. How are you doing, Mrs. James? Any pain? No? Wonderful. Alright. I'm going to make sure the catheter is in place by pulling. It is. Put this down. Now we're going to grab a urine sample. And clean this for 10 to 15 seconds. Alright. Let that dry for 10 to 15 seconds. Right. Go ahead and touch the syringe. I'm going to take out 10 milliliters. Urine. Wonderful. Put these down. Alright, Mrs. James. Now we're going to attach the tubing to the stat lock I was talking about. Do 20 seconds hand hygiene. Make sure it close. grab our sleeve. We're gonna clean the upper thigh with the skin protectant. Grab our stat locks. Sorry. Bag out. And then I'm going to clip the collection bag to the side of the bed, making sure it's secure, attaching any tubing, extra tubing to the bed. Alright, I'm going to string your legs out, okay, Mrs. James? Go ahead and get this under here. How you doing, Mrs. James? Doing good? Wonderful. So now, take off my gloves, do 20 seconds of hygiene. Sorry about that. And then I'm going to make note of the patient name, patient medical record number, and the date and time of the procedure. Go ahead and send this to the lab. Alright, Mr. James, how was that? Any pain or discomfort? No? Alright, well, I am going to be your nurse today, so please ring your call bell if you need me. Here's your call bell. Side rows up, bed in lowest position. Do you have any questions or concerns for me? No? Alright, and I'm going to take one last scan of the room, make sure the collection bag is working good, the tubing is not obstructed, everything's good. And I'll go ahead and clean my area up. And I dispose of everything in the right receptacle. And then I would also document the date and time of the procedure. I would document that the patient tolerated the procedure well. I would document the size of the catheter used, which was a 16 Frank. I would document that the urine was yellow, had no sediment, and was clear, and that there was 350 milliliters of urine. All right, and then I would... And thank you, Mrs. James. Hello, Mrs. James. It's Fernando, your nurse. How are you doing? Good. That's good to hear. Can I just confirm your name and date of birth? LeBron James, December 30th, 1984. Wonderful. And are you allergic to anything I should know about? No? All right. Good to hear. So, how's the catheter treating you? Do you feel any pain or discomfort? No? Wonderful. And does it feel like it's working? Like it's getting all the urine out of your bladder? Yes? Wonderful. So I'm actually here because I'm going to take out the Foley catheter. So let me explain what I'm going to do. So do you remember that small balloon at the tip of the catheter? I'm actually going to remove about 10 milliliters of saline. That's going to deflate the balloon. Once the balloon's deflated, I'm going to ask you to take a deep breath in, take a deep breath out, and upon exhalation, I'm going to pull the catheter out slowly, okay? And yeah, it shouldn't be a painful procedure. It might feel a little awkward or uncomfortable, but if you feel any pain, please let me know, okay? All right, do you have any questions or concerns for me? No? All right. And do you understand the procedure? Thumb up? Yes? Okay, thank you. Okay, so I'm just going to get everything ready, all right? So just sit tight for me. I'm going to close the patient's curtains for privacy. I'm going to do 20 seconds of hand hygiene. I'm going to place the patient in prone position. All right. Okay, there's a Chuck's pad between the patient's legs. Is it okay if I lift up the gown? Yes? Catheter looks good. And I'm going to move your legs in a frog-like position, okay? Any pain there? Any pain there? No? All right, wonderful. All right, so just sit tight for me, okay? So 20 seconds, hand hygiene. Gloves. James. Open this. I'm gonna open this. Step lock. All right, Mrs. James. I'm gonna start deflating the balloon. All right. Just going to make sure to pour all that out. And I'm just gonna double check I got everything. Yeah, I don't see any more saline, so I'm gonna go ahead and take that out. Okay, Mrs. James, I want you to take a deep breath, and on the count of 3, take a deep breath out, okay? Ready? 1, 2, 3, deep breath out, deep breath out. Great job. All right, I'm just gonna go ahead, wrap this up. Right. And then I'm gonna put your legs back. So how is that? Any pain with that? No? Good to hear. I'm just gonna put this back down. Okay, sorry, a little sting, soft. Dispose of this. All right. Okay. I'll be right back, Mrs. James. Just gonna go to the bathroom. So I'm gonna go to the bathroom, and I'm gonna pour the urine in a graduated cylinder. And I measured about 800 milliliters of urine. The urine was clear, yellow, and had no sediment. And then I would dispose of the catheter in the catheter bag in the right receptacle. I'm gonna go ahead and dispose of this. Do 20 seconds of hand hygiene. So how is that, Mrs. James? Pain-free? Yes? All right. So it's very important for the next 1 to 2 voids that we measure your urine. The reason for this is that it ensures adequate bladder emptying. And then for your first void, you might feel a stinging or burning sensation. But as you continue to void, that sensation should go away, okay? If you do feel an increased pain or bleeding while urinating, please let me know, okay? All right. Do you have any questions or concerns for me? No? All right. And then here's your call bell, side rails up, bed in lowest position. All right. I'm going to go ahead and document now. Thank you, Mrs. James. And then do 20 seconds hand hygiene. And then I would go ahead and document the date and time of the procedure. I would document that the patient tolerated the procedure well. I would document that the urine was yellow, clear, and had no sediment. And there was 800 milliliters of urine. And I would also make sure to measure the next 1 to 2 voids. And that's it. Thank you. And then I would clean up the rest of my mess.